people without OCD have distressing thoughts or repetitive behaviors. However, these thoughts and behaviors do not typically disturb their daily life. But for people with OCD, their thoughts are persistent and behaviors are rigid. Not performing the behaviors commonly cause them great distress. Many people with OCD know or suspect their obsessions are not realistic. Others may think they could be true, which is known as limited insight. Even if they know their obsessions are not realistic, people with OCD have difficulty disengaging from their obsessive thoughts or stopping the compulsive actions. Now let's begin with, well, then what is OCD? Obsessive-compulsive disorder. It is a disorder in which people have reoccurring unwanted thoughts, ideas, or sensations, which are obsessions, that make them feel driven to do something repetitively, which is a compulsion. The repetitive behaviors such as hand washing, checking on things, or cleaning can significantly interfere with a person's daily activity and social interaction. So you may try to ignore or stop your obsession, but that only increases your distress and anxiety. Ultimately, you feel driven to perform compulsive acts to try to ease your stress. Despite efforts to ignore or to get rid of bothersome thoughts or urges, they just keep coming back. This leads to more ritualistic behavior, which can lead to the vicious cycle of OCD. OCD often centers around certain themes, for example, an excessive fear of getting contaminated by germs. To ease your contamination fears, you may compulsively wash your hands until they are sore and chapped. If you have OCD, you may be ashamed or embarrassed about the condition, but you don't have to be because treatment can be effective. Now, obsessive-compulsive disorder usually includes both obsessions and compulsions, but it's also possible to have only obsession symptoms or only compulsive symptoms. You may or may not realize that your obsessions and compulsions are excessive or unreasonable, but they take up a great deal of time and interfere with your daily routine and social, school, or work functions. So we're going to start with the obsession symptoms. OCD obsessions are repeated, persistent, and unwanted thoughts, urges, or images that are intrusive and cause distress or anxiety. You may try to ignore them or get rid of them by performing a compulsive behavior or ritual. These obsessions typically intrude when you're trying to think of or do other things. Obsessions often have themes to them such as fear of contamination or dirt, doubting or having difficulty tolerating uncertainty, needing things orderly and symmetrical, aggressive or horrific thoughts about losing control and harming others or yourself, and unwanted thoughts including aggression or sexual or religious subject. Examples of obsession signs and symptoms include fear of being contaminated by touching objects others have touched, doubts that you've locked the door or turned off the stove, increased stress about objects that aren't ordinarily or facing a certain way, and images of driving your car into a crowd of people. Now, compulsive symptoms for OCD. Compulsions are repetitive behavior that you feel driven to perform. These repetitive behaviors or mental acts are meant to reduce stress related to your obsessions or prevent something bad from happening. However, exchanging in the compulsions brings no pleasure and may offer only a temporary relief from anxiety. You may make up rules or rituals to follow that help control your anxiety when you're having those obsessive thoughts. These compulsions are excessive and often are not realistically related to the problem they're intended to fix. As with obsessions, compulsions typically have a theme also, which could be washing and cleaning, checking, counting, orderliness, following a strict routine, and demanding reassurance. So, examples of compulsion signs and symptoms include washing hands until your skin becomes raw, checking doors repeatedly to make sure they're locked, checking the stove repeatedly to make sure it's off, counting in certain patterns, silently repeating a prayer word or phrase, and rearranging your canned goods to face the same way. Some individuals with OCD also have a tic disorder. Motor tics are sudden, brief, repetitive movements such as blinking and other eye movements, facial gestures, shoulder shrugging, and head or shoulder jerking. Common vocal tics include repetitive throat clearing, sniffing, or grunting sounds. Symptoms may come and go and ease over time or get worse. People with OCD may try to help themselves by avoiding the situations that trigger their obsessions, or they might use alcohol and drugs to calm themselves. Although some adults with OCD recognize that what they are doing doesn't make sense, some adults and most children may not realize that their behaviors are out of the ordinary, and their parents or teachers typically recognize the OCD symptoms in children. So, on severe severities, OCD may begin in the teen or young adult years, but it can start in childhood. Symptoms usually begin gradually and tend to vary in severity throughout life. The type of obsession and compulsion you experience can also change over time. Symptoms generally worsen when you experience great stress. OCD is usually considered a long-time disorder, can have mild to moderate symptoms, or be severe and time-consuming that becomes disabling. Now, causes of OCD go in the usual three categories, which is biological, genetics, and learning. In biological, OCD may be a result of changes in your body's own natural chemistry in the brain functions. In genetics, OCD may have a genetic compound, but specific genes have yet to be identified. And for learning, obsessive fears and compulsive behaviors can be learned from watching family members or gradually learned over time. OCD is a common disorder that affects adults, adolescents, and children all over the world. Most people are diagnosed by about the age of 19, typically with an early age of onset in boys, then in girls, but onset after age 35 does happen. The cause of OCDs are unknown, but there are three risk factors that are included, like genetics, brain structure and function, and environment. So let's go ahead and break each one of those down. Now, first, we're going to start with genetics. Twin and family studies have shown that people with first-degree relatives, such as a parent, sibling, or child, who have OCD are at a higher risk for developing OCD themselves. The risk is higher if the first-degree relative developed OCD as a child or teen. Ongoing research continues to explore the connection between genetics and the OCD and may help provide OCD diagnosis and treatment. Next, we're going to talk about the brain structure and functioning. Imaging studies have shown differences in the frontal cortex and subcortical structures of the brain in patients with OCD. There appears to be a connection between the OCD symptoms and abnormalities in certain areas of the brain, but the connection is still not clear. Research is still underway, and understanding the causes will help determine specific personalized treatments to treat OCD. And the last one is the environment. An association between childhood trauma and obsessive-compulsive symptoms have been reported in some studies. More research is needed to understand this relationship better. In some cases, children may develop OCD or OCD symptoms following a streptococcal infection. Now, it's sometimes difficult to diagnose OCD because the symptoms can be like those of obsessive-compulsive personality disorder, anxiety disorder, depression, schizophrenia, or other mental health disorders. And it's possible to have both OCD and another mental health disorder at the same time. So you want to work with your doctor so they can get you properly diagnosed and the right treatment. So there are 3 different ways you can be diagnosed by your doctor. You can have a physiological evaluation, a diagnostic criteria for OCD, or a physical exam. Now, with a physiological exam, these includes discussing your thoughts, feelings, symptoms, and behavior patterns to determine if you have obsessions or compulsive behaviors that interfere with your quality of life. With your permission, this may include talking to your friends and family. And the next one they do is a diagnostic criteria for OCD. Your doctor may use criteria in the diagnostic and statistical manual of mental disorders. And the last one is a physical exam. This may be done to help rule out other problems that could be causing your symptoms and to check for any related complications. Obsessive compulsive disorder treatment may not result in a cure, but it can help bring symptoms under control so that they don't rule your daily life. Depending on the severity of the OCD, some people may need long-term, ongoing, or more intensive treatment. The 2 main treatments for OCD are psychotherapy and medications. Often, treatment is more effective with a combination of these. So let's dive into each one and learn more. The first one we'll start with is psychotherapy. Cognitive behavior therapy, a type of psychotherapy, is effective for many people with OCD. Exposure and response prevention, a compound of CBT therapy, involves gradually exposing you to a feared object or obsession, such as dirt, and having you learn ways to resist the urge to do your compulsive rituals. ERP takes effort and practice, but you may enjoy a better quality of life once you've learned to manage your obsessions and compulsions. And the second one is medications. Certain psychiatric medicines can help control the obsessions and compulsions of OCD. Mostly antidepressants are first tried. Obsessive compulsive disorder is a chronic condition, which means it may always be a part of your life. While OCD warrants treatment by a professional, you can do some things for yourself to build your own treatment plan. You can first practice what you learn. Work with your mental health professional to identify techniques and skills that help manage symptoms and practice these regularly. Number 2 is to take your medication as directed. Even if you're feeling well, resist any temptation to skip your medication. If you stop, OCD symptoms are likely to return. Number 3 is to pay attention to the warning signs. You and your doctor may have identified issues that can trigger your OCD symptoms. Make a plan so that you know what to do if your symptoms return. Contact your doctor or therapist if you notice any changes in a symptom or how you feel. And number 4 is to check first before taking any other medications. Contact the doctor who's treating you for OCD before you take medications prescribed by another doctor or before taking an over-the-counter medication, vitamins, herbal remedies, or other supplements to avoid possible interactions. Now, coping with obsessive compulsive disorder can be challenging. Medications can have unwanted side effects, and you may feel embarrassed or angry about having a condition that requires long-term treatment. So here are some ways to cope with the OCD. Number 1 is to learn about OCD. Learning about your condition can empower you and motivate you to stick to your treatment plan. Number 2 is to stay focused on your goals. Keep your recovery goals in mind and remember that recovering from OCD is an ongoing process. Number 3 is to join a support group. Reaching out to others facing similar challenges can provide you with support and help you cope with challenges. Number 4 is to find healthy outlets. Explore healthy ways to channel your energy, such as hobbies and, and recreational activities. Exercise regularly, eat a healthy diet, and get accurate sleep. Number 5 is to learn relaxation and stress management. In addition to professional treatment, stress management techniques such as meditation, visualization, muscle relaxation, massages, deep breathing, yoga, or Tai Chi may help ease stress and anxiety. And number 6 is to stick with your regular activities. Try not to avoid meaningful activities. Go to school or work as you usually would. Spend time with your family and friends, and don't let OCD get in the way of your life. And like always, before I leave you, I want to share some celebrities who also suffer with OCD. Celebrities such as Daniel Radcliffe, Cameron Diaz, and Leonardo DiCaprio. Daniel Radcliffe, the Harry Potter star, dealt with serious OCD in his youth. He once stated it took him as long as 5 minutes or more to turn off a light because of his compulsions, and that seeking help was the most important step he made in coping with the disorder. Cameron Diaz said, "While the actress has yet to claim she has OCD publicly, she is known throughout Hollywood for her obsessions and compulsions. She's described as a frequent hand washer and has a fear of touching doorknobs, often opening them with her elbows or scrubbing them clean in her free time." And Leonardo DiCaprio lived with mild to moderate OCD for the most of his adult life. He often feels the urge to walk through doorways multiple times. While he claims to generally have the OCD under control, he says that when playing the lead character in the Aviator movie, a movie about an individual that suffers from OCD, he stopped trying to control it in order to do the best job at the lead role. Unfortunately, once he stopped controlling it, it became harder to control and took many months before he was able to limit the hold OCD had on his life. So if you're somebody that is struggling with OCD, just remember that celebrities out there just like us, and they suffer from the same mental health disorders we suffer from. And that the most important thing is to contact a doctor, learn as much as you can, and get the right treatment plan so you can live a better life. So, like always, I want you to know that you are never alone and that I love you.